Alberto. What was today's event? What was the aim of the event?
Well, today was a fantastic opportunity for us during the Women Health Innovation Summit in Basel to bring here our partners, our ecosystems, and the people that really care about the women's health topic. So that's why we wanted to bring all of them together, enjoying some drink, but at the same time to start to conversate and chat about these different problems that we are not able to solve alone, but we may be able to solve if we work together.
Right. And are you happy with the end result?
Well, fantastic. Yeah, I've seen people smiling, chatting, debating as well, some challenges there. So that's exactly why we are here. And this is also a bit of a preparation of what is going to be the Femtechnology Summit in June, 6th and 7th of June. So we started to somehow warm them up and then bring them forward until June, the next conversations.
Nice. Do you think there are going to be some other events like this in Basel or somewhere else at Roche sites?
We have several tools, as I call it. For us, events are tools because our opportunity to catalyze attentions and bring people together, experts on specific topics from the Roche organization, but also from outside. And we have several of them. On a monthly basis, we have Innolab Tech Talks that are going across the world. We also had today, actually, from Italy, the Healthcare Builder partner that is an open innovation program there. Next month, we are in India. We have every 2 years the Roche Digital Innovation Week that is really bringing together every part of the organization to look at specific topics like women's health. And we have Startup Days coming, also September. San Francisco is waiting for us. The community, the ecosystem there. There are fantastic opportunity to join us and to see what is happening because all these tools, all these events are there to enable real collaboration.
What's Innolab activity and role in women's health at Roche and in general?
Well, the Innolab is here to bridge a bit, to connect business problems that we identify across the organization in the women's health, of course, area, and we connect them with potential digital solutions that are there outside in the market, in the ecosystem. So that's where we position ourselves. So we constantly look for business opportunities, business challenges, and real problems that are there. We create a pipeline and we scout. We help the organization to scout really outside. Then as soon as we identify the digital solution, then we start to experiment. We explore. We try to see if our hypothesis can be matched with a digital solution that we identified. And then hopefully we can scale them later on in the organization.